Good afternoon and welcome to Cancer Conversations. It's a program put on by UNC Lineberger's Comprehensive Cancer Center. I'm Jennifer Potter and I'll be your moderator today. Today we're going to be speaking with Dr. Gallagher about living well with breast cancer. But before we get started, I wanted to call your attention to the email address on your screen as well as the phone number. If you have any trouble during the presentation and need some assistance with sound or visuals, please call us at 919-445-1000. The email address on your screen is going to be used for questions to be submitted that our presenter can address at the end of her presentation. That email address will be at the bottom of your screen throughout the slides, so please don't hesitate to send us questions. We'd love to hear from you and make sure your questions are answered. So today we're going to be talking about living well with breast cancer. We have Dr. Gallagher with us. She is the director of our breast center program, and she's going to be talking with us about different ways to live as a survivor of breast cancer. So without further ado, I'm going to turn it over to Dr. Gallagher.
Thank you, Jennifer. So yes, today we're going to be talking about living well with breast cancer. Which I think is a really important topic. After you get a breast cancer diagnosis, there's different kind of phases within the journey that this comes up, and you'll see some common themes hopefully today, but I'll try to kind of break it down and provide some tips and tricks that might make things a little easier, or at least let you know about some resources that your providers have to offer. So a diagnosis of breast cancer is the beginning of a journey. It's not a journey anyone chooses. There are different phases, like I mentioned before, where individual needs are different at each phase. Not every woman or man experiences every phase. And today we're going to talk a little bit about living well during each of these phases. The first, and you can see them listed, there's three main phases that I'm speaking of. Having a new diagnosis of breast cancer, and then having a history. So after you've been through cancer treatment and you enter into what we call survivorship, that also poses its own set of concerns and questions when it comes to living well with breast cancer. And then the third is being diagnosed with metastatic breast cancer. And we're going to talk a little bit about what that is here in a few moments. So first we're going to talk about a new diagnosis of breast cancer. This is when you have either presented for an abnormal mammogram, or you've presented to your doctor's office with a new breast mass or nipple discharge or something concerning something that's wrong in the breast. You will undergo a biopsy, and a physician will call you with the biopsy results. These 4 words, "you have breast cancer," are words that will change your life forever. They force you to face many complex medical, psychosocial, emotional, legal, and financial concerns. No one wants to hear these words, but once you have, you start a journey that will forever change you. Again, today we're going to talk about some of these emotions, some of the things that happen whenever you start this journey, how you cope with them, and resources that are available. We can help you face these challenges by connecting you with trusted breast cancer information and a community of support. So what is breast cancer? Breast cancer starts when cells in the breast start to grow out of control. It's the most common cancer in women in the United States, with exception of skin cancers. There are many emotions when you hear those words. It's normal to feel a range of emotions following the diagnosis and during treatment, but some are more common than others. Not all will be negative emotions such as fear, anxiety, depression, anger. Sometimes you'll experience some more positive emotions such as empowerment and feeling motivated to make changes in your lifestyle. Everyone has a different emotional reaction to breast cancer and its treatment, and it's important to realize that not everyone's experience is the same, and it's okay to feel all of these things. Some tips for coping when you're first diagnosed. Number 1, understand your diagnosis. Ask your doctor questions. You can do some research on your own once you receive the pathology report so you can kind of find out a little bit more about your individual cancer diagnosis. It's important, though, if you research online, you go to reputable sites, and we'll talk about those a little later. Some examples would be like the Susan G. Komen site, or UNC has several areas that you can kind of explore and learn more about your cancer diagnosis. There's also different groups like MD Anderson and Mayo Clinic that also have resources that are available. It's really important to stay away, at least initially, from some of the chat rooms or forums, because everyone has a different experience, and sometimes other people's experience is going to vastly differ from yours. And until you know a little bit more about your specific diagnosis, it can be quite scary hearing other stories because you don't know what to expect. When you come to see your treatment team, bring a journal or a binder to help you keep records. This is really important. You want just a consolidated way to keep track of what your diagnosis is and then to help you formulate a treatment plan. Second, make a plan. This is going to be a conversation with you and your treatment team. You want to know the treatment plan and create a timeline with your doctors. Again, every person's experience is a little different. Some women may have surgery first, some women may need chemotherapy first, and this treatment plan is going to be tailored to your specific needs. Finally, have a support system. This can be family, friends, a church group, neighbors, or other support groups, but it's really important that you identify these individuals early on. If they can, it's helpful to have someone attend your clinic appointments with you. They can help you to keep notes and have a second set of ears, so if you get home and you have questions, they're another person that you can talk to. Finally, share concerns with your treatment team. Ask for help. If you don't understand something, ask. It's okay to ask questions, and it's okay to say, I don't know, I'm overwhelmed, tell me what I'm going through, help me make this treatment plan, but ask your providers for help. There's support in support groups. They can identify and kind of help you get in with. There's financial assistance opportunities, so that's a really big stressor after being diagnosed with breast cancer. Many patients are very healthy up until this point, and this is the first time that they see bills rolling in from different clinics and different physicians and different treatments, and it can be really stressful figuring out how to take off work, how to go to your clinic appointments and your treatment, and still make ends meet and pay the bills. There are programs that are available, and you need to ask your treatment team to help you identify those programs that would be a good fit for you. Medications, you're going to be on some medications at some point, likely during your treatment plan, and these have side effects. Talk to your doctors about the side effects and what you can do to help those. And then finally, see if your treatment team has a group. So here at UNC, we have something called CCSP, which is the Comprehensive Cancer Support Program. This is an excellent program, and I have a slide later dedicated specifically to that. But they provide a lot of resources for patients that are free and easily accessible. So let's talk a little bit about breast cancer treatment. There's two different areas that we focus on when we talk about formulating that treatment plan. So number one, we want to think about local control. And what does that mean? That means taking care of the breast cancer in the breast and the surrounding lymph nodes and making sure minimizing the risk of it coming back in the breast. Treatments that are specific for local control are surgery to remove the cancer and radiation, again, to treat the rest of the surrounding tissue to minimize the risk of it coming back. The other thing we have to think about is what we call distant control. So even if you have a small tumor in your breast and your lymph nodes are clear, there's always the possibility of microscopic cells that are circulating through the rest of the body. Distant control identifies that, and it prevents cancer from going to other places in the body. The only way to think about distant control as far as treatment is with medications. Again, surgery and radiation are for local control, but distant control in the rest of the body, we think of medications. Medications could include chemotherapy, targeted therapies, or hormone blocker pills. And these are going to be very individualized to your specific cancer, and your doctors will talk to you more about that. So after you have a new diagnosis of breast cancer, you move on to treatment. We just discussed that. What happens after you get through the immediate treatment of breast cancer? Well, this enters a phase we like to call survivorship. This is finishing your cancer treatment, and now we're going to continue to follow you to make sure that this cancer does not come back. What is survivorship? Having no signs of cancer after finishing treatment. This is what every patient wants. It's something called NED, or no evidence of disease. Some doctors will call this. It's important because even though we have no evidence of disease, we have to follow the breast and the rest of the body to make sure that it doesn't come back. Another way to define survivorship is living with, through, and beyond breast cancer. I like to tell my cancer survivors to focus, though, not just on surviving, but actually thriving. So instead of just focusing on their prior diagnosis of breast cancer, I want them to think about what they're going to do next with their lives, to really thrive, to move past their diagnosis while still keeping their surveillance visits and making sure that there's not anything that's concerning, but actually being able to move forward and start to live a healthy, enjoyable, more normal life. It's hard to think about having a normal life after you have a diagnosis of breast cancer, and it can be really challenging. But if we can kind of help you get through that portion and back to a normal life, that's really what we want to do. There are many reactions whenever you get to survivorship. For some, they're elated. They're through chemotherapy or treatment or surgery or radiation, whatever their treatment plan is. They appreciate life. They're so thankful that that part is done and it's behind them. They are more accepting of themselves, for some women. For other women, treatment can take a toll on your body, whether it's the medications piece or whether it's surgery and scars. It can be challenging to, again, feel more like you and feel normal. And so that's something that patients in survivorship can struggle with. And then feeling anxious about their health. So you've been so focused for so long on the treatment, and now suddenly the treatment's over and you don't have anything to really, there's not a next step. It's the waiting game of, okay, well, I'm going to go to my appointment, but when's the other shoe going to drop? Is this real? Am I really cured? Or am I going to have another diagnosis in a year? And so for some women, that's very anxiety provoking, and it's hard to cope. Not knowing how to cope after treatment ends. So these are all things that are important to consider. Again, common emotions: appreciating life more, being more accepting of yourself, feeling more anxious about your health, it's also possible, and not knowing how to cope after treatment. These are very common emotions, and these are all normal emotions to feel. It's important as you feel any of these emotions to recognize that this is okay. This isn't wrong to feel this way, but you want to reach out for help. And whether that's with your support group, whether that's at home with your family or with your providers or treatment team, it's important to ask for help when you need it. So some common considerations we're going to talk about today during this survivorship period. We're going to focus on body image, bone health, diet, nutrition, exercise, emotional health, and sex and intimacy. And we're going to talk about kind of some tips and tricks on some of the common side effects and how you can cope with each of these. So body image, what is it? It's the way you perceive yourself and how you look. A positive body image is people who have a positive body image feel good about how they look and how others perceive them. They don't feel like they need to lose weight or change their appearance to be more attractive to others. It's not because they have a perfect body or are more attractive than others. It's because they feel good about how they look. It includes emotions, your emotions and beliefs and perceptions of your body. Do you feel whole after breast cancer treatment? Are you accepting of the surgical scars that you have? Are there things that you still struggle with? Do you have issues with range of motion of your arm or swelling of your arm called lymphedema? Do you continuously have to treat these things? And this all plays a role in body image. Some things that you can do if you have a negative body image, or talk to your doctors. If you're not happy with the surgical scar or the way things look, see if there are options to correct that. If you have problems with arm mobility and function, see a physical therapist and they can refer you to one, or start kind of exercising and stretching and they can give you specific exercises and stretches to do to try to kind of help to break up the scar tissue and start to move normally so that you feel more like you. Bone health is another big topic. So things that impact bone health most commonly is age. The older we get, the more likely that our bones lose kind of the strength and become more susceptible to fractures and breaks. Other things that can speed up this process include common breast cancer treatments, such as chemotherapy, hormonal therapy, surgery, or ovarian suppression. Those all have a big impact on bone health. And the reason they do is breast cancer treatments affect your body's ability to make or use estrogen, which is good if you're stopping the cancer cells from growing and multiplying, but by lowering the amount of hormones in your body, it can also cause your bones to lose density faster and put you at higher risk for osteoporosis. So when we think about bone health and treatment, there are some things that you can do to improve your bone health at home. The biggest thing is exercise. So walking, and I tell my patients 30 to 60 minutes 2 to 3 times a week is really recommended. And just kind of walking around the block, getting out, being active. Other things that are excellent are things like yoga. Yoga is one of those kind of all-inclusive exercises. It helps both with kind of meditation and kind of calming your mind if you're anxious, but it also helps with stretching and strength. And so we talked about that range of motion problem. Yoga is really good to kind of stretch everything. After radiation, it's common for that breast tissue and the skin and the muscles in the shoulder to kind of tighten over time. And so yoga is really good to continuously stretch those muscles out and kind of break up anything that's tight, wanting to tighten. Nutrition plays a role, specifically supplementing with calcium and vitamin D, and your doctors can talk to you about what would be recommended for you. Finally, sometimes it doesn't matter what you do, you still have bone loss or bone density loss, and so you need to have medications to supplement this. And this includes medications such as bisphosphonates, Civista, Prolia, and these are medicines specifically directed to improve your bone density and your overall health. I get this question a lot. What should I eat? Are there tips for healthy eating, and does that play a role in my cancer diagnosis? And I say yes. Actually, we know that women who are obese or have a high, what we call body mass index, they have too much weight, will have extra estrogen circulating in their body and are at higher risk for breast cancer development and recurrence. And so again, diet and exercise will help to minimize that risk. Some tips for healthy eating are build a menu for you. So think about what you like and make a list of things that you like, foods that you like and that you don't like. And then look for recipes based on these ingredients. If you're using the internet to look for recipes, add the term simple because it will kind of help you to find ideas for easy to make options. Think simple and try to cook something that doesn't require a lot of preparation. If you really kind of go big at first, you're more likely not to stick with a plan because it takes a lot of time, and for some women they don't have as much time as others. Plan ahead. So beginning of the week, make a set schedule for the rest of the week, and then shop according to your plan and your checklist. When you're in the grocery store, it's important to really focus on the areas of the grocery store in the front, back, and side aisles. I don't know if you've ever paid attention, but that's really where the healthy choices are, is around the periphery or the outside area of the grocery store. So that's where your produce is going to be, your fresh meats, your healthier options. As you start to get towards the center of the store, your healthy options decrease rapidly. And then finally, ask for help. If you just don't even know where to start, you want to have a healthy diet, but you don't know what's right, what's wrong, what's good, what's bad, ask your treatment team. Most hospitals, including UNC, have a nutritionist that you can meet with, and they can actually start to help you build a plan that's right for you. Emotional health. Through any phase, this is really important to consider. It's important to recognize your feelings. Every woman's response to a diagnosis is different. At first, it may be hard to grasp the news or to believe it. You may feel numb or stunned, as if you're watching someone else's life play out in front of you. You may feel sad, scared, worried. These are all common things. And even after you finish treatment, some of these emotions will happen again. It's important to recognize your feelings, realize that it's okay to experience or feel all of these things, and then make a plan as far as how to address it or how to look at it. It's important to remember that you are not to blame. This is not your fault that you were diagnosed. I tell everyone that there are some genetic kind of familial genes that run in families that put you at higher risk. But for most women diagnosed with breast cancer, it's sheer dumb luck. We know the older you get, the more likely you are to have a breast cancer, which is why it's important for women to have mammograms so that we can catch or find things earlier when we have lots of treatment options. But remember, you're not to blame. Coping with uncertainty can be really challenging. So again, we finished the treatment plan, and now the question is, what's next? Or maybe you have another abnormal mammogram and you need a biopsy, but you don't know what that biopsy is going to be. Every step, there are times of uncertainty, and that's the hardest part. It's the hurry up and wait, and that can be really trying. And so when you are coping with uncertainty, it's important that you talk to your treatment team and your providers to make a plan. Also, share things with your support. Again, whether that's friends, family, your loved ones that are close, support groups, that other cancer survivors that you've connected with. Make sure you have a support group at home that you can share these things with so you're not alone. Sex and intimacy. This is something that is really impacted after breast cancer treatment, and all of these treatments impacted in some way. Surgery causes scars. For some women, they have the option of saving the breast and just taking out the mass or the cancer. For other women, they have to remove the entire breast. And this plays a role in how you feel and how you see yourself and how others see you. And it can really play a role in feeling like you want to be intimate with anyone. Radiation, similar. It's going to cause kind of skin burns and change the outward appearance of how you look. But it can also, if you have what we call radiation fibrosis or kind of firmness and hardening of the breast, it can cause pain, which makes touch uncomfortable. We talked about having range of motion issues and having kind of a shoulder that doesn't move the way it used to. And so when your body is not moving the way that you used to, it can be hard to engage in certain activities. Chemotherapy and hormonal therapy play a big role, especially the side effects of those. For many women, it causes vaginal dryness, and it can make intercourse or sex painful. Stress plays a big role. It can kind of reduce our what we call libido or our drive for sex, as can some of the other therapies. And so it's important when you're experiencing these to talk to your providers, Tell them what you're going through. If you're having a hard time with vaginal dryness, there's some over-the-counter things that you can try. I tell patients to try something called Replens, which is available. It will help with the vaginal dryness. Another easy thing that's just kind of over-the-counter is coconut oil. It's very good. It's organic. It's something that works really well and is safe for breast cancer patients. For some women, they tell me kind of the silicone-based lubricants really work. And so you got to try several things and figure out what's right for you. Talk to your treatment team though, and they'll advise you further. So what happens with metastatic breast cancer? What is that? What does that mean? Metastatic breast cancer is when breast cancer spreads outside of the breast and lymph nodes to other organs, such as the bone or lungs. That's common. But anywhere outside of the breast and the lungs that's breast cancer becomes a metastatic breast cancer. That's what we call stage 4 cancer. The difference for that, we talked about being diagnosed with an earlier stage breast cancer as being treatable and curable. For stage 4 metastatic breast cancer, there is no cure. However, we can treat it. The treatment focuses on shrinking the size of the cancer and slowing its growth. It also focuses on easing kind of side effects from the cancer, such as pain. Living with metastatic breast cancer really changes your life. It's something that you then have to kind of think about every day. Managing the disease becomes part of your daily life with treatments, and many women are on medications for the rest of their life to try to keep this disease at bay. It's important when you're diagnosed with metastatic breast cancer to acknowledge your feelings. Again, we've talked about sharing with families, friends, support groups. Even counseling. Ask your treatment team and providers. Sometimes it's nice just talking to someone that you're not living with or seeing on a day-to-day basis, someone that's completely removed. Sometimes it's easier to open up about how you feel when you're talking with another clinician that really focuses on you, and you can start to see things through a different lens or window. It's also very important to remember you are not alone. No one expects you to be strong, brave, or together all of the time. You can cry, you can laugh, you can be angry. All of those things are okay. But you really want to make sure that you include those around you and talk to them, because you don't want to handle this alone, and no one expects you to. Everyone's going to be there for you, including your treatment team. If you find that you don't have close friends or family at home, ask your providers. They can get you set up with support groups for other women who are living with metastatic breast cancer, and they can become your friends and support group as well. For metastatic breast cancer, the treatment options are a little bit different. We talked about metastatic cancer is not curable, but it is treatable, and so it's important to define the goals of treatment when you're diagnosed. And this is something that you and your doctors will talk about. Ask about clinical trials. There are many clinical trials that are ongoing that you might be eligible or a candidate for. And it's important that you ask and you advocate. A lot of it is dependent on the type of cancer you have, where it is, what its characteristics are, and what previous treatments you've had in the past. But ask your doctors and explore kind of other alternative treatments. Part of your treatment may include hormonal therapy as well as targeted therapies for different receptors, chemotherapy, radiation, and then it's important through all of these different phases that you're taking care of you. And a really good way to do that is with yoga, with exercise, with finding different support groups, people that you can connect to and talk, because it's all about connections. So let's talk a little bit about self-care for stress and anxiety, because these are common emotions that you'll feel with a diagnosis of breast cancer. Limit your online browsing. Online research, while helpful, can also be very stressful. You want to limit the length of your sessions by searching for specific topics rather than just browsing. If going online or reading books about cancer makes you tense, you can also choose not to do it. Ask your doctors for good resources specific for you, and they can give you resources in the form of written materials. They can give you online resources that are more applicable to you, places that you can go that are safe. Safe places to talk. So again, establishing that group of people that you trust, whether it's friends, family, or your support groups. No matter how loving and supportive your friends and family are, talking to someone outside of that circle sometimes can also be helpful. Many people and groups have experience in handling the stress and anxiety that arise from living with metastatic breast cancer. One-on-one counseling, support group, and social media within the communities are opportunities that are available. Being physically active brings lots of benefits, whether you go on a walk, take a dance class, lift weights. Movement strengthens your body and can help to reduce your tension and improve your spirits. Exercise also is a good way to help connect with other cancer patients. There are many workout groups, exercise groups. Here at UNC, we have a group called Get Real and Heal, and you can connect with other cancer survivors while being healthy. Spirituality. So this kind of goes even further than going to church or finding kind of meditation, really being able to dive down into you and figure out what makes you tick and find the things that are going to be helpful for you is going to be important. And so whether that's church and prayer and friends and support or meditation or yoga, figure out what makes you tick and how you can kind of explore those resources to help you. Relaxation is very important for stress and anxiety. There are many different apps for that you can actually download on your phone. There are websites that you can visit. You can talk to your doctors and treatment team. There are groups that will help you to kind of relax, whether it's with meditation, whether it's with soft music. This is a big way to help reduce your stress and anxiety. Mindfulness is incredibly important. So taking everything in perspective, remembering kind of where you are. When your mind starts racing, back up for a moment and be present in that moment. And the first steps are stop, not necessarily stop thinking about what you're thinking, but start thinking about things that are immediate to you. So take a deep breath. Focus on what you hear, what you sense, what you smell. Close your eyes so you're not distracted, and really kind of start to take in some of those sensations. Give them a name, identify them. Bring yourself out of that anxiety situation and back into the moment will help you start to open up your mind and deal with things with a more clear mind. Yoga is very good. Creative art. Find something you love, whether it's painting, whether it's running and exercising, whether it's, going out with a group of friends and enjoying nature at a park. Find something that you love to do and make a point to do it once a week, once a month. Make a point to get out and pencil in time, schedule time for you. Laughter, always a very good medicine. Be around people who make you happy, who make you laugh. And again, that could be friends, that could be family, it could be a support group. Maybe if you don't have those things, it's watching a really good movie that makes you laugh. Find things that bring you joy. That'll make you have a different perspective and a happier outlook on life. Pets are great. I was telling Jennifer earlier, I have a little dog and she is just the joy. It's wonderful. It doesn't matter how late I get home at night. She is always happy to see me. Pets are a very good resource. They give love unconditionally. They don't hold grudges. They're happy to see you when you get home. It's very much a support that you can lean on, whether it's a dog, a cat, a fish, whatever you can. If you have the opportunity to get a pet, that's another good resource to reduce your stress and anxiety, especially if you're caring for them and thinking about their needs. It gets you out of being stressed over what you're going through. UNC, again, has a comprehensive cancer support program. They have lots of different things, and if you're a patient here at UNC, I encourage you to kind of check them out. Different support groups and counseling groups. They have Patient and Family Resource Center with a library that has lots of excellent resources. Health and coaching, again, dietitian, nutritionist, so they can help you plan your healthy living and your meals. There are exercise programs such as Get Real and Heal, so things that are available. In addition, they have information about financial assistance and programs that may help you, whether it's making ends meet as far as monthly utility bills or helping kind of cover cancer costs that you can't afford. It's really important to meet with these individuals and kind of talk about what options you have. There's an excellent integrative medicine group that's here, and they kind of look at conventional therapies and non-conventional therapies, and they try to pair them so that it's safe for cancer patients, and it's really an excellent resource. Again, nutrition, and then finally survivorship, talking about these hard issues in a specific clinic. Other resources, you can go online and learn more about the UNC CCSP group. Great websites that I would recommend are Living Beyond Breast Cancer, and really that's a wonderful resource that'll kind of talk to you about lots of common problems, different symptoms you're having with tips and tricks, as well as living with metastatic disease. They really talk about lots of different things. Metavivor is a very good resource, especially for patients who have metastatic breast cancer. And then the CDC, really, if you kind of look at cancer and breast cancer, they have very good is a very good resource and have excellent information. And with that, I will take questions.
Thank you so much, Dr. Gallagher, for your time today. That was a great presentation, and I know our audience appreciated it as much as I did. We did have some time for questions. Oh, I'm sorry. The address is on your screen. It's cc@med.unc.edu, and we have some time now to answer those questions, so please send them through. We did have a couple come in while you were talking, and someone asked specifically about dietary supplements and how you can use them as a patient undergoing treatment and then as a patient who's finished with treatment, if that's advisable, if there's any concerns. So can you talk about that?
Yeah. So first of all, anytime you're thinking about any kind of supplements, it's really important to talk to your treatment team. Depending on what treatments you're undergoing, some of those supplements, even if they're available over the counter, can counteract with some of the medications that you're on. So it's really important to have a conversation before you start something new. There are absolutely supplements that are really good depending on what symptoms you're having. Again, we talked about bone health and having calcium and vitamin D. But again, it's really important to have these conversations with your doctors just to make sure you're not taking something that wouldn't be recommended with your specific cancer treatment. It's also important, so especially if you have hormone receptive breast cancer or ER, PR, estrogen and progesterone positive breast cancers, that you stay away from supplements that may have hormones in them, such as estrogens or progesterones. And so you want to kind of really know what's in the specific supplements, which is again why I recommend talking to your doctors, talking to the breast cancer nutritionist, meeting with the pharmacist about some of these supplements, because it'll be really important as far as if that will actually affect your treatment.
Okay, thank you. Then someone asked if you could explain what happens in a survivorship clinic.
Yeah, so the survivorship clinic actually they do several things. And sometimes in a survivorship clinic you can get much of what you need just with your regular surveillance visits with your surgeon or your radiation oncologist or your medical oncologist. But usually at those visits they really kind of focus more on what your mammogram shows, how you're tolerating treatments, making sure there's no evidence of recurrent disease. Survivorship clinics take it a step further, and they really kind of focus on these more relevant issues. So sex and intimacy. Are you having vaginal dryness? If you bring that up to your providers, they'll talk about things that you could try, but the survivorship clinic is a great clinic to really ask these questions and try to kind of see how you're doing rather than waiting for you to bring up some of these issues. They do talk about kind of diet, nutrition, and exercise. They make sure that everything is maximized for you, and they'll give you a summary of your prior treatment team, or your prior treatment plan, and what you've completed, so that if you were to move out of state or go somewhere else, you kind of have that prior treatment plan. So it's a very good clinic. Again, many patients are obtaining what they need with their regular visits. Other patients would like to ask more questions or really kind of have those check boxes, and I think it's a very good place to start.
Okay, thank you. And one more question is how common is it for breast cancer to come back?
So this is a very good question. A lot of it is dependent on your overall stage. And so when you present with a breast cancer in your breast, they're going to look at the receptors. So we have kind of more characteristics about your cancer, the size of the cancer, the lymph node status, and do we see any evidence of distant disease or cancer elsewhere. Breast cancer recurrence is very kind of personalized and individualized these days. Sometimes your treating physicians will even order a specialized test, what we call a genomic test, which is a test on the cancer itself to tell us its risk potential, if it's kind of higher risk of coming back or if it's lower risk of coming back. And that really helps to drive treatment plans. So someone who has a relatively small cancer and no lymph nodes, well, if they have a really high-risk cancer, they may still need chemotherapy to minimize the risk of it coming back. So it's not really a specific number. It's kind of putting the whole picture together and figuring out for you how risky your cancer was.
Yeah, not a very cut and dry answer.
I know, I wish I had a simpler answer.
That's okay.
Mm-hmm.
Well, continue to send in your questions. Usually our presenters welcome the opportunity to answer questions that pop into your head as the day progresses. And again, the address is on your screen. But we want to thank Dr. Gallagher for her time today. It's always wonderful to have you here and speak to the topic that you know so much about. So thank you. Oh, let's see. Oh,
One more?
Sorry, one more. If you all have time, we have time. This person asked, I'm currently using a compression sleeve for lymphedema. How long? I wonder how long is expected before my body learns to reroute the fluid so I don't need these items anymore.
Lymphedema is one thing, and yes, it's a big topic of conversation because for women who experience lymphedema, it can be really challenging to treat. Lymphedema is, some women have some minor symptoms, such as like minimal arm swelling or kind of just feeling like a heavy arm. Other women have arms that are 2-3 times the size of the other arm, and it really limits their mobility and their ability to do things. There are, from a surgical perspective, there are treatments we do or kind of surgical procedures we do to minimize the risk of lymphedema. It's always best if you can prevent it before it even becomes a problem. But afterwards, after surgery and radiation with lymphedema treatment, there are lots of different options. Some women need a compression sleeve, which it sounds like is what you're wearing. Other women need kind of more massage or therapy to the arm. Some women even require kind of machines that massage the arm while they're sleeping or during the day. So there's lots of different ways to treat it. In general, what I tell patients, so with surgery and radiation, it usually takes kind of about a year for everything to kind of normalize. And so even if you have lymphedema right after surgery or right after radiation, you may not have it a year, 2, 3 years from now. Other women may have it chronically. So it really is dependent. There are now surgical options for patients who have chronic lymphedema. So after you get out of that year period, if you have really severe lymphedema that's not managed, there are some surgical options. And in fact, we just recently recruited one of our newer plastic surgeons because he specializes in some of these surgical approaches. And so really meeting with your doctors, talking about your symptoms, seeing what the severity of your lymphedema is, and making the treatment plan that's right for you is really important. And again, if you need axillary lymph node surgery, ask your surgeons about ways to minimize that risk, because there are techniques available, and they can talk to you more about that.
Thank you. I'm glad we took time for that question. Okay.
Something I'm passionate about.
Well, this time we will definitely wrap it up. So just want to call your attention to our topic next month, which is extremely timely given that it's constantly on our news channels every night, and that'll be vaping, cigarettes, and other forms of tobacco use. And we'll be meeting here on November 22nd at 12. So again, thank you so much, Dr. Gallagher, and thank you all for tuning in.